Hello, everybody. My name is Gabriel Quesada from El Salvador. We are going to talk today about the visualization of the retina with the small apertures IOL implantation. These are my financial disclosures, and what we want to comment today is about how the small aperture IOL uses the pinhole principles to provide uh, extended depth of focus. And this is a retrospective case control study of our early experience with this technology for more than 2 years now, and to make clear that the reproducibility of the fundus retina photography and macular OCT is easily and possible. So the question that everybody asks is, does the lens interfere with the view of the posterior segment? And visual acuity have been reported in Europe from the small aperture IOLs with very good results. But we evaluate in this study the relative ease of visualizing and documenting the posterior segment. So again, the purpose of this study was to evaluate the visualization of the retina by clinical examination and fundus photography through a small aperture IOL. At 1 month post-op from implantation of the AcuFocus IOL, patients were examined clinically by an ophthalmologist and with fundus photography and OCT by a trained technician. We examined 109 eyes of 74 patients. We used a fundus camera photography, the Nidec non-mydriatic, and the macular OCT SOCT Copernicus from Optopol. We have 3 different groups. One that had the small aperture IOL on the non-dominant eye, 40 patients. The second group was 30 patients with bilateral small aperture IOL, and the third group were irregular corneas with the small aperture IOLs, 7 patients with radial keratotomy, 1 patient with a penetrating keratoplasty, and 1 patient with keratoconus. And the results are really interesting. All ophthalmologists reported no significant impediment to retinal examination by direct or indirect ophthalmoscopy. All technicians reported that was readily obtaining images with the fundus camera and the OCT. And the ophthalmologists reported no difficulty in evaluation of any of the images obtained by the technicians. These are some of the examples. You can see on the left an eye with a monofocal IOL, and on the right an eye with the small aperture IOL, and you can see the images of the retina that can be taken easily. Also the OCT, another example of another eye. You can see perfectly the retina. And in special cases like this one with a radial keratotomy, you can see myopic retina. So in conclusion, we will say that in all cases, the mask in the small aperture IOL allowed good imaging of the posterior segment. Technicians and ophthalmologists reported that OCT and other routine diagnostic testing can be performed successfully, and different instructions for posterior segment exam with a small aperture IOL are not required. Thank you very much.